South Asians have a higher degree of certain chronic diseases, 2 to 3 times the rate of diabetes. We have 2 times the greater rate of heart disease, stroke, kidney disease. Those numbers are pretty huge and they're pretty significant and they're growing. In Fraser Health, we have approximately 250,000 South Asians. How do we get people to take care of their health so that they can prevent disease from happening? My mom, she had chronic disease, she had diabetes. I remember her, she liked her sweets, and although she would say to us that I don't eat sweets, but I do know she'd sneak them in. And although she was a type 2 diabetic, I think there was probably good learning opportunities for her that, when I think back now, I wish that I had done a little bit of better job.
Chronic diseases, there is no magic wand, first of all. Disease will always be with us. So what we're trying to do is minimize it, delay it, and then as much as possible, delay it till later life.
When we initially started, some of the tactics that we used were we would set up a booth, we give people information on an assortment of different types of healthcare topics, from cardiac disease to chronic disease, etc. We realized very, very quickly giving people information and telling them what to do was not going to work. So we realized that the ultimate goal is to empower people to get the community moving in a healthier direction.
Well, getting some of the material we pass on to employees, but most cases we notice is they put it on the side and have it thrown away. I get more comfortable this way actually, to bring the professional people to the site and sit down and have a one-to-one discussion or question answer in the session, and that worked really good actually.
If it was one size fits all, like say, okay, let's go to the Gurdwara, give them information, and that's going to make people change, I think many people have tried that. It doesn't work. We adopted what we call the Apnee Sehat design lab. So we focused on a lab methodology, and so you put the patient or the person in the center of it, and you design all your models, all your interventions around the person.
I think what really helped us was, of course, the drive and passion and commitment of people that have been directly involved, but also improving what we do all along the way. So finding out what's going well, finding out what's not going well, and making adjustments as we go.
For our Sehat program, we had to narrow our focus down to food. Then we narrowed it down even more because we know with South Asians, what do we love? We love our sweets. And that's where our focus right now is on sugar. When we had our food models at the Gurdwara, that started to stick. When we had the slides, people started paying attention.
जलेबी लैंड गए ना पहला ऊपर देख रहे भी ਇਹਦੇ ਚ ਕਿੰਨੇ ਚਮਚੇ ਸ਼ੂਗਰ ਓਕੇ ਜਦੋਂ ਪੜ੍ਹਦੇ ਨਾ ਇਨਫੋਰਮੇਸ਼ਨ ਸਾਨੂੰ ਬਹੁਤ ਹੀ ਹੈਲਪ ਪਰੌਂਠੇ ਖਾਣ ਲੱਗੇ ਰਸ ਸੋਚੀਦਾ ਹੁਣ ਪਰੌਂਠੇ ਵੀ ਨਹੀਂ ਖਾਈਦੇ once in a while not always ਅਸੀਂ ਲੱਡੂ ਵੀ ਸ਼ੇਅਰ ਕਰਦੇ ਜਲੇਬੀ ਵੀ ਸ਼ੇਅਰ ਕਰਦੇ ਸ਼ੂਗਰ ਖਾਣੋਂ ਹਟਦੀਆਂ ਨਹੀਂ ਹੈ ਓਕੇ ਸ਼ੂਗਰ ਨਾ ਖਾਓ ਸਾਰੇ ਫਿੱਟੇ ਕੱਲ ਤੁਹਾਰੇ ਰਿਜ਼ਲਟ ਆਪੇ ਦੇਗਾ ਸਿਹਤ ਦਾ ਖਿਆਲ ਰੱਖਾਂਗੇ ਰਿਜ਼ਲਟ ਆਪੇ ਆਏਗਾ.
So that's the key of our program, is that how do we empower people? How do we get people to sort of say, you know what, I'm going to take control of my health, I'm going to help my family take control of their health, and I'm going to help my community take control of their health.
ਗੁਰਦੁਆਰੇ ਦੇ ਵਿੱਚ ਅਸੀਂ ਆਉਂਦੇ ਆ ਆਪਣੇ ਮਨ ਦੀ ਸ਼ਾਂਤੀ ਲਈ ਆਉਂਦੇ ਆ. ਮਨ ਦੀ ਸ਼ਾਂਤੀ ਤਾਂ ਹੀ ਹੁੰਦੀ ਆ ਜੇ ਤੁਹਾਡੇ ਸਿਹਤ ਠੀਕ ਆ. ਜੇ ਤੁਹਾਡੀ ਸਿਹਤ ਹੀ ਠੀਕ ਨਹੀਂ ਹੈਗੀ ਤਾਂ ਤੁਹਾਨੂੰ ਮਨ ਦੀ ਸ਼ਾਂਤੀ ਵੀ ਨਹੀਂ ਮਿਲਦੀ, ਤੁਸੀਂ ਤੇ ਆ ਵੀ ਨਹੀਂ ਸਕਦੇ. ਇਸ ਕਰਕੇ ਅਸੀਂ ਫੀਲ ਕਰਦੇ ਹਾਂ ਕਿ ਜਿੰਨੇ ਵੀ ਇੱਥੇ ਸੰਗਤ ਆਉਂਦੀ ਆ ਉਹਨਾਂ ਨੂੰ ਦੋਨੋਂ ਪਾਸਿਆਂ ਦਾ ਪਤਾ ਲੱਗ ਸਕੇ, ਬੈਨੀਫਿਟ ਹੋ ਸਕੇ ਵੀ ਸਾਡੀ ਸਿਹਤ ਵੀ ਕਿੰਨਾ ਅਰੋਗ ਰਹਿ ਸਕਦੀ ਆ ਅਤੇ ਸਾਡਾ ਮਨ ਵੀ ਕਿੰਨਾ ਅਰੋਗ ਰਹਿ ਸਕਦਾ ਆ.
So that's our focus at the Gurdwaras, and helping the kitchens to reduce the amount of sugar in their recipes. Sehat Works is working with local businesses, empowering their employees to making healthier choices at work and at home. We have Sehat shops, helping people to make informed decisions about making healthier food choices when they go grocery shopping. And then the last one we have is actually working with local restaurants and helping them to adopt informed dining, which helps the customers being better informed about what the nutritional value is in the food choices that they're making. So some of the bigger changes that we've seen in the community are a few gurdwaras we've been working with quite closely for the past year, and they've now reduced their sugar in their recipes by 25 to 30%.
ਅਸੀਂ 2000 ਪੀਪਲ ਦਾ ਲੰਗਰ ਬਣਾਉਂਦੇ ਹਾਂ 2 to 5000 ਦੇ ਵਿੱਚ ਹੁੰਦਾ, ਕਿਸੇ ਦਿਨ ਜ਼ਿਆਦਾ ਆ ਜਾਂਦੇ, ਕਿਸੇ ਘੱਟ ਆ ਜਾਂਦੇ। ਹੁਣ ਲੋਕੀ ਅੱਗੇ ਨੂੰ ਜਲੇਬੀਆਂ ਬਹੁਤ ਘੱਟ ਖਾਂਦੇ ਆ, ਸਾਡੇ 1-2 ਟਰੇਆਂ ਬਚ ਜਾਂਦੀਆਂ ਤੇ ਅਸੀਂ ਬਣਾਉਣੇ ਵੀ ਅੱਗੇ ਨੂੰ ਘੱਟ ਆ ਜਲੇਬੀਆਂ, ਕਿਉਂਕਿ ਲੱਗਦੇ ਹਨ ਲੋਕੀ ਇੰਨਾ ਮਿੱਠਾ ਖਾਂਦੇ ਨਹੀਂਗੇ। ਅੱਗੇ ਨੂੰ ਫਰਕ ਪਿਆ ਕਿਉਂਕਿ ਤੁਹਾਡੀ ਉਹ ਸਲਾਈਡ ਦੇ ਨਾਲ ਸਾਨੂੰ ਬਹੁਤ ਫਰਕ ਪਿਆ, ਪੀਪਲ ਮੋਰ ਐਜੂਕੇਟ ਹੁੰਦੇ ਆ। ਜਿਹੜਾ ਹੋਮੋ ਮਿਲਕ ਕੋ 80% ਆਉਂਦਾ ਸੀ ਤੇ ਹੁਣ ਸਾਡਾ ਘਟ ਕੇ 20% ਤੇ ਆ ਗਿਆ। I am looking 100%. I am 67 year old and I am healthy.
ਕਿੰਨਾ ਤੋੜਦੇ ਆ ਦਿਨ ਵਿੱਚ?
20,000 step. I have a Fitbit. Money is nothing. Health is the wealth. So then we are young, we learn that, and I keep my health. We are thankful for Fraser Health from the Guru Nanak Sikh Temple.
One of the keys, I think, to our success has been we've made it culturally relevant. So we speak the language, we provide the information in a language that they understand, we provide information that's in a culture that they can relate to, and then we provide it in the setting where they're in their own culture.
It's a learning journey for both Fraser Health and the community, because it's as much learning for us to learn about population needs and patient needs and community needs, and also for us to deliver the care where it's needed.
Thank you. A wonderful job. You guys being here, this is in your face. This is saying, you go upstairs, you come down to the langar, everything's ready for you.
My employees are my assets. To keep them happy, to keep them healthy, we have to do all those things, whatever the best way we can. And also, as ethical duties, we want to keep our community healthy. And I really, from my heart actually, truly, the state program is really good. Of course, the other businesses, I encourage them to take advantage of this because this is worth it.
ਮੈਂ ਪਹਿਲਾਂ ਕਦੇ ਲਵਾਇਆ ਨਹੀਂਗਾ, ਅੱਜ ਪਹਿਲੀ ਦਫਾ ਇਹ ਸ਼ਾਟ ਲਵਾਇਆ ਨਮੂਨੀਆਂ ਦਾ।
ਅਸੀਂ ਕਿਉਂ ਨਹੀਂ ਪਤਾ ਲਵਾਇਆ?
ਕੋਈ ਦਿਮਾਗ 'ਚ ਨਹੀਂ ਆਈ ਗੱਲ, ਵੀ didn't think about that.
That's what we need to do. We need to empower people so that it's not just Fraser Health who owns the messages, but as South Asian community, how do we help each other out? So our goal is to scale our Apnee Sehat Design Lab so that it goes into every temple, every gurdwara, every mosque in our Fraser Health community. Sometimes this many people make this much of an impact. We actually could make this much of an impact. Think about it.
This is a grassroots. This is the only way you can make a difference to them. You can't go to them individually, but as a group event like this, it's fantastic. Slowly, it's going to trickle out. It's a slow process, but this is the beginning. I think they're becoming more aware now. People are talking about it. Now they're going to go home and talk about this with their kids and family members, and that'll get the conversation going. So a lot of it is just education. Once they find out, they spread the word.
We are hopeful that by education, by engaging, by empowering, we could have a successful outcome which will then truly create healthy communities. So I think we really feel that we should think globally, though we act locally, but our impact will be global. So yes, this is the right time for us, the right place, for the right reasons that SAHI started, and we are really excited that it will achieve what we are set out to do.
I know going to Gurdwara is only so much we can do. I know that going into the businesses is only so much I can do. I don't have a huge team of people, right? But we have very, very smart people that if we collectively put our minds to it, a small group, we can make this much of an impact. I want people to be able to relate to it, not sort of say, oh, that's just a Fraser Health program. I want them to say, oh, this is about myself, my culture, my family, my friends, my community. That's what I want people to see.